Hello, and welcome to our webinar, An Introduction to Person-Centered Thinking, offered by the National Association of State Head Injury Administrators. Today, we'll hear an overview of the general concepts of person-centered thinking and how it differs from person-centered planning. We'll learn how everyday thinking can create a foundation for change and action that empowers and impacts the individual, as well as organizations and systems. I'm Carrie Bennett, Chair of NASHIA's Training and Education Committee, and Gabriela Lawrence Soto is our webinar organizer today. Thank you for joining us. If you're unfamiliar with NASHIA, we are a nonprofit organization created to assist state government in promoting partnerships and building systems to meet the needs of individuals with brain injury and their families. A GoToWebinar user guide is available for download from the NASHIA website. This is a great resource for making the most of your live webinar experiences. A handout of today's presentation is available for download. Check your attendee control panel for the handouts pane. To ask a question during the webinar, please enter it in the questions pane, and our organizer will forward your question to our speaker after the presentation if time allows. If we run out of time, the presenter will respond to your question via email. Today's webinar is the first in our series on person-centered planning. These webinars are free, but if you would like a certificate of participation to use in pursuing continuing education credits, note that NASHIA members and non-members may purchase them at the NASHIA website. All webinars in this series will be recorded and archived at the NASHIA website as well. Our objectives today are to receive an overview of the foundations of person-centered thinking, understand the value of important to and important for concepts, hear and see examples of how people are utilizing person-centered thinking in their lives, and hear and see practical examples of how person-centered thinking is having positive impact in people's lives. Before I introduce our presenter today, we have a couple of poll questions for our audience. Gabby, will you please launch the first poll question? We would like to know if you are involved with person-centered planning in any way. Please select yes or no. Okay, let's see what our audience said. Most of you are involved in person-centered planning. Wonderful. And if you are, since you are involved in person-centered planning, we would like to know a little bit more about how you're involved. Gabby, thank you. And what did our audience say? Many of you are involved as other. I guess we're not sure what that means, but thank you for providing that information for us. And now I'm very pleased to introduce our speaker to you, Lisa Meyer. Lisa has worked in the human services field for more than 35 years. Most recently, she was the director of Tuscarora's Intermediate Units Training and Technical Assistance Program. The TIU manages a statewide training and technical assistance program on behalf of the Pennsylvania Office of Developmental Programs. Ms. Meyer and her team provided statewide training, which included person-centered thinking training as well as technical assistance that supported implementation of state policy and procedure. Her educational and professional accomplishments include a Bachelor of Science in Business and a Master of Education in Curriculum, Supervision, and Instruction. She has been trained in maps, paths, and biographical timelines. She is certified by the ASTD Association for Training and Talent Development, Designing Learning. Ms. Meyer is recognized by the learning community for person-centered practices as a credentialed person-centered thinking mentor trainer and coach, and a plan facilitation mentor trainer. Currently, Lisa supports states with the implementation of person-centered systems, person-centered thinking training, coaching, planning, facilitation training, and person-centered thinking trainer credentialing. Welcome, Lisa.
Good afternoon, everybody. I'm very excited to be here with you this afternoon and to have an opportunity to present for you about person-centered thinking and person-centered planning. I'm going to quickly just touch base on the learning objectives again. So we'll be looking at the foundations. Hopefully by the end of the webinar, you'll feel as if you have a better understanding of the difference between person-centered thinking, person-centered planning. We'll look at the foundational concepts of person-centered thinking, which are important to and important for concepts with regard to supporting people with any kind of disability. I do have some examples included in the presentation this afternoon that will show you how people are using person-centered thinking in their lives today. You'll get some more examples about positive impacts that person-centered thinking is having on people's lives as well. And then I'd like to introduce you folks to what's referred to as a one-page profile or a one-page description that people are using on a day-to-day basis, and we're getting some really good feedback from people who are using that document. Some people refer to it as a profile, some people refer to it as a description. So there's the big question. What is the difference between person-centered planning and person-centered thinking? And I think this is a good place for us to start, just so that we can clarify and everyone has a really good understanding. So person-centered planning, it's not so much a new technique for planning as it is a new approach to or a new type of planning that's kind of underpinned by a very exact set of values and beliefs that is very different to the current norm. When you think about that, it's the planning that takes its primary focus to the person. So that's the difference with this type of planning, as opposed to a disability or a service or some other issue. It's really about looking at that person as a whole person, as opposed to really being a disability management focus, which is different for us. It's also about citizenship, inclusion of family, inclusion of community, and the mainstream of life and self-determination, and it requires some very fundamental changes for us, fundamental changes in thinking. And it reestablishes the balance of power. The implications of using person-centered thinking as part of planning has potentially enormous and far-reaching results for people that we are, as professionals and family members, supporting. With person-centered planning, we think about the vision of the person's life, and the vision of the person's life not only to themselves personally, but also what kind of vision does that person have in relationship to their community or being involved in the mainstream. Person-centered planning should describe the actions that are needed to move the person in that direction. With person-centered planning, we also look at discovering the opportunities to discover new information, to learn, and to be able to respond effectively to the person's aspirations, keeping in mind their capabilities and concerns. that they might have in being able to accomplish their vision and accomplish their goals. There are several planning methods and techniques. I'm going to focus on a few of those. And these are some of the ones that some of you on the call have probably heard before, because I see that we had a number of folks that have heard of person-centered thinking and planning, and you might be involved. So the ones I want to focus on are maps, paths, biographical timelines, the one-page profile and description, and look at these as resources for helping people plan. So I'm going to start with maps. So maps has been around for a long time, as some of you may know. It was developed by Jack Pierpoint and Marcia Forrest back in the mid-1980s. And maps uses a graphic process. The process is important to the person, and the person has a circle of support that helps them in developing their map. The map is comprised of 6 steps, and it is also done as a drawing or a graphic of sorts, and it really helps to paint a picture of the person using the group of people that have been invited to participate in the map meeting. So the first segment of mapping is we listen to the person's story, and then we want to hear their dream and honor their dream or their vision, recognize the nightmare, which may sound a little funny, but we all have those kind of down times in our life or moments that we don't want to repeat because they were negative types of events in our lives. Name our gifts, say what it takes to receive the gifts, and then agree on action steps. The MAP group process really enables the group that is supporting the person to clarify the person's gifts, to identify that person's meaningful contributions, and also think about the necessary conditions for contribution. So if a person is not able to contribute in the way that they'd like to, what can we do as the group to support that person in making it happen? And looking for opportunities to support the people in being able to make valuable contributions. So I'd like to show you Bill's map. This is just an example of a map for a young man named Bill. And if you look at this, the map is, you can see, very involved, and you can tell here that graphics were used to develop this map for Bill. The reason that Bill and his team created this map is because Bill was looking to change his home life. He wanted to have a different living situation. He had some things in his history, such as being in a state hospital for a lot of his life, that really impacted his ability to get his dreams met and move forward in his life. So you can see here that there's an area for history. You see the dreams, looking at Bill's current reality at the time, what kinds of support needs he might need, and then the group actually had an opportunity to do some action planning with Bill. The next area I want to share with you is the path. A path is, people will do a path when they want to look at a situation that might be a little complex and require really specific action. Other people are involved with the person, people of their choosing, and the difference in a map and a path is the path really wants to hone in on making the vision real. So what can we do? You think about a person's vision, and then you want to make that vision real. The path was also developed by Jack Pierpoint and Marcia Forrest and John O'Brien as well. It can be used for various types of planning styles with individuals. It can be used with organizations to look at organizational change. But when it's used in person-centered planning, the focus person and the person that they want to invite, They meet together. There are always two facilitators, someone to do the graphics and someone to manage facilitation in the process. With a path, it works well when the person definitely has a group of people around them who know them well, and it enables the person to really understand their path, the direction they want to go in, and then take control of their situation. I want to show you Mary's path. This is Mary's path, and you'll see it looks a bit different from the map that we looked at for Bill. So with Mary's path, I'll tell you a little bit about Mary. Mary was really looking for a way to advocate for herself better. And she had tried to voice her thoughts and her wants and wasn't able to communicate that to the staff that was supporting her effectively. And so what the team did was, after many attempts on Mary's part to get a vision of a life that she wanted, the team agreed to sit down with her and develop a path. After a year passed from the time they developed the path, she had actually achieved a lot of the goals that she teased out in her path. She was going out to her neighborhood pub. She had learned to read. She had been on vacation to New York, but in many ways she was still frustrated because she felt that some real high priority things for her, for example, like living in the same house, she wanted a different living situation. Those kinds of things had not been met. And so she used her path from the year before to sit down with her team the following year and to really use it to help her find her voice and speak on her own behalf and really facilitate her own annual meeting. And she was able to let the folks on her team know that she still was very serious about being able to go to college, to be able to find work. And it was really a very effective instrument for helping her have that critical conversation with her team. So I want to move on to biographical timelines. With biographical timelines, sometimes called a biography timeline or a lifeline, it's also a facilitated process in which the team of people that are representing a person, they come together, they have some discussion, but not only that, they take some ownership in doing some research around past events, past passages in a person's life, and looking at interventions in the person's life, lay out the facts of what happened in that person's life in a very, very linear fashion. And it enables the group who's supporting the person to really help correlate that information in a meaningful way. The person can look at that and hear that and see how past events, even though some of them may seem insignificant in context to other events, they can see that some of those events have actually had an impact on that person's life and may affect who that person is today and the things that they would like to do into the future. So I'm going to show you John's timeline now. This is his biographical timeline. And I hope it's easy for you to see the differences in the different types of planning resources, because there are several. But these three are three that I use myself all the time. So with John's biographical timeline, John's team did a lot of research, as you can see here. What his timeline shows is that from the time that John was born until he was almost 5 years old is the time that's reflected here, if you can see that. And it also notes some really pretty significant events in John's life that actually ended up impacting his adult life as well. The timeline is telling us that John's great aunt had a psychiatric illness There was also some alcohol abuse on the maternal side of his family. John had a normal birth. He set up and said, Dada at 6 months of age. At 13 months of age, John started walking. Shortly after that, he was potty trained and he spoke using full words. Now, if you look at John's mother and father's down under where it says Vietnam on the left side of the screen at the bottom, you'll see that John's mother was treated for depression but refused treatment. She also had epilepsy and was taking Dilantin and phenobarbital for the epilepsy. His dad was 25 and was in the Vietnam War, but the team really couldn't find out any data to show how long he was in the war. And then if you look over toward the middle of the timeline, right along the line there, you'll see that when John was 2.5 years old, his sister was born. And right about that same time, John stopped talking. He also started having seizures, was said to be cognitively delayed. And by the time he was 3, he was said to have had a language delay and to have overactive behavior. So the significance of doing research like this and tracking a person's biography can have some very meaningful impact when it comes to planning for someone. The one thing I'd like you to take away from this and looking at these different types of resources is keeping in mind that before we plan for people, we first need to understand and embrace person-centered thinking, which is where I'm going to go next, is to think about person-centered thinking. So before we can support a person well and to the best of our ability, we need to have the thought process that helps us be good person-centered thinkers. So you may be thinking now, okay, what is person-centered thinking? So person-centered thinking actually is the underlying foundation that we need to have as planners and as supporters. The idea of person-centered thinking is that people have positive control over their lives, that they are recognized and valued for their contribution. So this is a bit of a twist from thinking about this idea of the disability first. We first want to value people's contributions, which enables us as planners to then think about, let's capture the person's gifts, give them opportunity to do as much as they can, and then how do we, as supporters, plan for and support the person around any disability that they may have. And so we're thinking about, and talking about supporting people not only around their contributions and the gifts they bring, but also thinking about how can we support people in having that really rich web of relationships that are both natural relationships, like friendships, neighbors, community, but also around the idea of people who are paid to support people with disability. And that can be anything from a person who might be paid to come in and provide a couple hours of support in the home. It can look very different. But again, we not only want to think about family, friends, and community, we also want to be able to support people who are being paid to support people with disability and being able to do that in a way that is person-centered. The other point that we always emphasize when we're thinking about supporting people is this idea of informed choice. So we are really looking at how to mobilize and involve the person's entire social network as well as resources from the service system. So put the service system aside. What other resources are out there? Where are there resources where we can pull those resources in to help us in responding to what is expressed and helping to bring about whatever changes are desired by that person? So we all want an intricate network of people in our lives. All of us want that. We want friends, we want family who are there for us in times of trouble, in sadness, and in celebration. Those friends take an interest in us over our lives because we all share those common threads that bind us to one another. And we want the same thing for the people that we're supporting. Those people that are sharing with us those common threads, they're the same people that we value in our lives. They help us achieve our dreams, or they lend a hand when we're in need. We can count on them to be there for us. These relationships are formed in many ways, but generally they come from meeting people in different places and in different environments. Meeting people for most of us occurs naturally and for the entirety of our lives, but sometimes we struggle in making those really connected relationships for people with disability. So I also like to talk a little bit about community and helping people kind of have their own self-directed lives in the community, and how do we do that? Um, if we think about people who are using services and the ability for them to have positive control over their lives, if they are to have self-directed lives within their own communities, then the people who are around the person, especially those who do the day-to-day work, they really need to have person-centered thinking skills. Only a small percentage of people need to know how to write good person-centered plans, but everyone involved in the person's life needs to have good person-centered skills. It's the value-based skills that underlie the planning. So if we all have those value-based skills, those person-centered thinking skills, the planning will come because those people with the skills are always communicating with the person who writes the plan and does the planning. So community capacity development, partnering, helping people find their voice. As you know, one of the goals of the disability system is really to help people with disabilities get connected, to help them maintain relationships in their community. As professionals and caregivers, family members, and friends, our role is to support people in establishing these connections and helping them in developing the skills needed to maintain those connections by being a good community member. So there is this role of reciprocal. How do we help people be reciprocal in being a good community member? Other key areas where we provide support are in supporting people with disability and finding their voice, and also advocating for themselves. We also want to ensure that we're supporting people in reciprocating by way of relationship, by encouraging the person to get back to their community, by making sure we're helping the person build the skills they're going to need to be a good community member, to have the type of knowledge and understanding that if the expectation is for others to care about you as a person with a disability, then we need to help them demonstrate that through their actions. Then the person with a disability needs to also be willing to demonstrate the reciprocal. So with person-centered thinking, we really want to just get to the core issue of the person, looking at how the person is now, how they would like their life to change, and what can we do to support them in making those changes happen, and also what will it take to make the change happen. We always want to make sure that we're making arrangements to follow up on plans on a regular basis once they're developed. We always want to review the plans, making sure that we're noting progress, that we're putting things into action, and updating the plans as the person grows and moves on. And maybe there's a need for more change, that we're not just looking at paper that's just going to get stagnant. The planning process is really our opportunity as family members, as professionals, to really support people in keeping the planning process alive and meaningful. And then we always want to be mindful and record learning on an ongoing basis. So making a commitment to discover ways to not only capture new information, but how do we keep it going on an ongoing basis? The other thing we want to think about with person-centered thinking is thinking about that balance of what's important to the person, and then what's important for the person. And sometimes that can be a challenge. And then what are others expected to know about what's important to and for the person? And what support do we need for them to make sure that we help them in maintaining that healthy balance? A little more about person-centered thinking. Sometimes things don't need to change. And that is always something that is really very important for us to remember and think about. Um, we want to support a person in making change when it needs to happen, but sometimes things need to stay the same. So when we are thinking about a person's history, perhaps there's a reason why things need to be the way they are today. And so we want to think about that when we're planning for people, to make sure that as a person's growing and experiencing, that we're also respecting that history, and that when we need to keep things in place so that we're not rocking the boat and setting the person back, that we do that, and that we're mindful of that. So person-centered thinking is actually a set of skills. And there are several skills that I'll go over with you in just a second. So the skills that you'll hear about in a few minutes actually reinforce the values of person-centered thinking. So the skills help propel the learning cycle. They help us support people rather than feel like we have to fix them, because no one's broken. It works for all people, these concepts, and they also work at every level within any organization. Person-centered thinking skills are great for building a culture of learning, partnership, and accountability. And the one belief that I always take away from person-centered thinking is the belief that everyone can learn. It may take us as supporters a little more work, or being a little more creative, to support people in their learning, but we do have a firm belief that everyone can learn. So the learning community of person-centered practices actually designed and wrote the curriculum for person-centered thinking training. Um, the learning community of person-centered practices is made up. It's an international group of people that believes in best practices related to person-centered thinking. There are people from many countries involved in person-centered thinking. Countries such as Australia, Canada, United Kingdom, and of course the United States. And I like to always show this because the learning community is a great resource for more information on person-centered practices, person-centered thinking. If you're interested in more information, you can see at the bottom of your screen, thelearningcommunity.us. If you want to use that link to find their website, it's really an invaluable resource. This is one of the person-centered thinking tools that I'd like to show you. It's a relationship map. and a relationship map. And these are all resources that anyone can use in supporting people. And it really, these tools are helpful for us, as I said, in helping us be more person-centered. So this relationship map actually is used to give us a picture of who's in the person's life and who's not, who the person is closest to. And it tells us who may have information that we may need and who can help us do some learning about the person to figure out what's important to the person or maybe how best to support a person. And so the way that you complete a relationship map is the person that you're planning for, their name goes in the middle. And then you also want to be able to think about who are those family members in the person's life. And person can use names. The closer the name is to the person's name in the center is an indicator of how close emotionally the person is to the person in the center, the person you're planning for. And then you do the same with friends. You may have 5 or 6 friends. Out of those 5 or 6 friends, you may have 2 that are really, really close to you. Their names would go real in um, the center circle that is around the person circle that is closer as an indicator that you have 2 of those 5 friends are really very close to you. And then on the left, you'll see people who support me at work or school. You can do the same there. And then people whose job it is to support me at home and other places. So those would be paid supporters. So, for example, the person who cuts your grass or your doctor or your hairdresser. So that's how you use a relationship map, which can be very effective and helpful when you're helping a person plan. Rituals and routines are an area that we have looked at over time. And what we found is that looking at a person's rituals and routines really help give us a lot of very rich information about things that need to be in place, where we need to be consistent in supporting a person, and also where are those areas where a person really wants to have control. They don't want anyone else stepping in for them. So in thinking about things like spirituality, what are some of those rituals that the person has related to spirituality? We also want to look at areas of grief, loss. What do people do when they're not feeling well? Some of us may want to just, have some time alone. Um, we have different things that we do as far as rituals, when we don't feel well. Even thinking about things like birthdays. What kinds of things do we do for our birthday? And if they don't happen, it's not our birthday. I'm sure some of you on the webinar, you may feel like your birthday's a national holiday. But we're finding those rituals and routines and paying attention to them and being mindful of them can really um, make a person have a very good day or maybe a not so good day. Which brings me to the next resource, which is Good Day, Bad Day. So we think about good days and bad days, and we're also using this resource to learn some really rich information about supporting people. So you actually want to use this tool to think about and talk about and tease out, what does a good day look like for the person? And jot those things down. And then thinking about, what does a bad day look like for a person? And you may think like, why would you really be interested in a bad day or a stressful day or a difficult day? And it's because we want to avoid those things. And so we want to take time to think about, what does a bad day look like, but also what causes it and how can we avoid it? That way, we're in a better position to have the person have as many good days as possible. And that's all part of the planning process. The next resource that I'm showing you is called a communication chart. A communication chart, this is one of my favorites actually. With a communication chart, you are using this as a means to listen to behavior. We want to look at the things that people do or don't do, and they are actually a mechanism to us getting some good feedback from them, some good communication. So if you're looking at the chart on your screen, you're seeing that we're looking at what's happening in the environment, what the person does, what do we think it means? So we're doing some respectful guessing here. By what we're seeing or hearing or feeling, what do we think that means? And then lastly, what should we do in response to what the person does or doesn't do? So I have an example here. This is my Aunt Cleo, and this is me with my Aunt Cleo. And you can see here that my Aunt Cleo had significant disabilities. I think I was about 3 years old here. And it's a picture of me and my Aunt Cleo. And I can remember my grandmother always saying, let's put on the freeze. And I really don't know what that meant, but we were putting on the freeze there in this picture, me and my Aunt Cleo. But the thing about my Aunt Cleo is I grew up with her, but she could only say like 6 words. So she had real issues around communication. So I actually developed a communication chart for her. And I'm showing that on the screen now just to give you an example of how a communication chart can really be very helpful and effective. And so what I did here was put down some of her behavior. So if you look at the second row across, um, so what has happened, or it just happened in the environment, is that a person that my Aunt Cleo didn't know had entered my grandparents' living room. And then what she would do is she would begin to make these loud noises and frown and cry out like she was just really beside herself. And then what our guess of what we thought that meant was that she had some issues with men, short story. And then what we did was we put our response to what we were seeing, our response to her behavior, what action should we take? We put that in the very last box on the right. And so we were not only doing that as a family, but we also wanted to let people know who didn't know her that well, this is what you need to do when this happens. So it's an opportunity to give people really clear direction on what they should do and what they should not do. And her chart was actually 2 pages. So I'm going to move on now to reputation. So reputation is a conversational tool and a skill. And so what you do with reputation is we're learning to look at positive reputation, but also negative reputation. And we learn how to practice it and how to support people with negative reputations without it becoming a barrier to their good life, which is really important. We all have reputations. So we want to think about reputation a little differently. We don't want to make it a life sentence. We want to look at what can we learn from that and how do we still help people have that vision for their good life. Another skill is the 4+1 questions. The 4+1 questions actually help us learn from our efforts and focus on next steps. So we're looking at what have we tried on behalf of the person, what have we learned about the person, or what we tried, what are we pleased about, and what are we concerned about. These are great questions that can be used to start an annual meeting. They can be used to talk with a team about something, a new experience that you tried with the person. But again, another way to gather valuable information. The next tool is a learning log. We use a learning log to record information as it's happening. It's different from a progress note. As you can see by the headings, you can use a learning log to record what you learned about what worked well with the person. What did you like about the activity? What needs to stay the same? And then also thinking about what didn't work so well. Are there things we need to avoid? There's also a place for the date. What did the person do? What, where, when, how long did it last? Who was there? This also allows you to capture the names of any staff or friends or family that participated, but it really is a nice opportunity to um, have new experiences with the person, but also log it so that other people are aware and mindful as well. The next resource that I want to show you is called a matching profile. This is a very really cool tool to use. It's used to describe what a good match looks like between the people who use services and those who provide the service. This can also be used when anytime you're bringing two people together. Very helpful to know what the similar personality characteristics are, what shared interests do they have. We all, as humans, we gravitate toward like-minded people, people who kind of are interested in the same things or interested in, think the same way that we think. And that's a great opportunity to use the matching resource. So this is our conceptual framework here, and it helps us look at the relationship between health and safety and having what's important to us as well as hopes and dreams. This is just a really nice way to, in a nutshell, capture that we all want to have our own dreams and journeys, but we also have things like health and safety that we have to keep in mind. But when it comes to things like health and safety, we all want the ability to address those kinds of things on our own terms. The next thing I want to think about and show you is this foundational concept for person-centered thinking. This is the core of person-centered thinking, keeping in mind and thinking about what's important to people, what's important for them, and using these two concepts to help help plan for them and with them. And this isn't always easy. There's usually a healthy tension between what's important to us and what's important for us. And you may be wondering, what do I mean specifically by things that are important to us? Those things that help us feel satisfied. Think about things like relationships, status, control, the places we go, things we do, rituals, routine, rhythm, pace of life, and things to have. All of these things are examples of things that can be important to us. The other thing, too, to be mindful of is that important to also includes behavior. So when those things are in conflict, words and behavior, we always want to go with the behavior and look at that behavior and, acknowledge that, even though you're telling me you're fine, from what I'm seeing, you don't really look fine or you don't act fine. So when those words and behavior are in conflict, we really want to pay attention to the behavior and then start to peel the onion and ask why. Important for is usually related to issues of health and safety. So when we say important for someone, we're thinking about things like illness and medical conditions, what it takes to support them in being well, issues around their environment like safety, physical and emotional well-being, and also being free of fear. So we're looking at that balance. We think about important for, and if people get only things that are important for them, you end up with a lot of healthy, unhappy people. And when people just get nothing but things that are important to them. This is where people begin to get confused about choice and think that, all choice is, and it really leads to that idea of no responsibility. Because when we say that, it's their choice and throw our hands up, that's certainly not what we mean by person-centeredness. We're looking at really that balance between important to, important for, understanding consequences around choice, and trying to help people have that really healthy balance between the two. This is a tool for important to and important for. It's another resource that you can use when you're supporting people, it's just a template, and you can use it to help a person sort out things that are important to them and important for them. We also, around rituals and routines, you can use those as well in helping tease through things that are important to a person. And when you look at using rituals and routines along with important to, you're actually beginning to really dig deep around things like rituals. So, for example, is it really important that a person check to make sure the doors are locked before they can sleep well, if you're looking at a going to bed ritual? Is it really important to that person that they brush their teeth and wash their face before they go to bed? All of those areas are going to look very different for everybody, and you can use that important to and for to capture some of that rich information. I also want to tell you about this one-page profile or description. This is a template for the one-page description. If you look at it, you can see here that it captures, this one that I'm using for your example, it captures what's important to me at work. I've done this with several people who have reported to me that worked for me, and people really, really love this. So you can use all of these resources in all kinds of different ways. And then you look at how best to support me at work. What do others like and admire about me? So what do the people at work say they like and admire about me as a person? So this is a way that you can create a one-page description. If you're doing one for yourself, the things that you can think about are some of your rituals and routines that make a difference in your workday. Are there things in your home life, work life that are important that you want to include in your description? The other one that I really love is thinking about what drives us to approach things the way we do. And are there things that in our life that if people knew about them, it would help them understand us better? Other things to think about are, what do you hope to accomplish? And include these things under what's most important to me. And then thinking about, what do other people need to know in order to support us well? Do we have specific hot buttons that we want people to know about so that they can avoid that, pushing our buttons? Are there specific weaknesses and areas that others could help us address specific things? And you include those under how best to support you. And then, I talked earlier about good days and bad days. What's going to make us have a good day? What are some of the things that make us have a bad day? And can people do specific things that would help make our time together more productive? Are there things that people should avoid? And then under like and admire, we're looking for things that people see as qualities in you that they might acknowledge, or qualities about yourself that you want to jot down under that like and admire. This is another template that I just wanted to show you. It still has the same different areas that you would complete for a one-page description profile. Here's another one example. This one is a little interesting because it's actually broken down into personal care, money's management, getting out in the community, etc. You can also apply these concepts with people that you support at work or even your family. And you're basically doing the same thing. It's going through a process of looking at the rituals and routines, thinking about what's important to them in other parts of their lives, how would we support and understand them better, etc. Other things to think about are places where they might need specific support, and also what do other people need to be mindful of and respectful of. Um, and then again, thinking about good day for them, what makes a bad day, what can we do to make time in the classroom, at work together, or at work together be a little more productive. I have some examples here that I want to show you really quickly of some one-page descriptions for some students and young adults. And this is Michael's one-page description. This is a two-page description for Rachel, and Rachel needs a lot of physical support. She's not able to move around on her own. And here again is more information. She has a lot of complex medical needs also. This is Jeremy. Jeremy did his one-page description because he was looking for work. And it's really cool because he not only said what's important to him in a work environment, but he also used this to tell people how best to support him. You know, like needing a large enough workspace for his wheelchair so that he can get around, etc. This is a couple of one-page description profiles for teachers. They use them not only to do with their students, but they did them on themselves. One for Prue as well is another teacher. There are very many uses for a one-page description or profile. You can use them for IEP meetings, ISP meetings, any kind of annual plan meeting. And also, people are using them in the educational field, potential employers, transition age kids, team building to share with colleagues, friends, and family. This is one for my grandson, Tiernan. His family and myself, we developed this for him when he was ready to go to kindercare. So you can see that these can be very, very versatile tools and resources. I wanted to end and just say that whatever kind of planning that you're doing is just to recognize and remember that every style of person-centered planning is really rooted in that person-centered way of thinking. It's made up of a set of value-based skills that result in seeing the person differently and give us a way of acting on what we learn. The other thing to remember is that training in person-centered planning is training in a way of thinking as much as it is a way of developing a plan. For people being supported by services, the pervasive presence of person-centered thinking is what really matters. I really thank you all for your participation this afternoon. It's been a real pleasure.
And thank you, Lisa. This was a wonderful presentation. We are so excited to have you on board for this today. Gabby, did we have any questions from the audience?
One question that came up, Lisa, was folks wanted to know if they will have access, if you'd be able to share the tools that you presented on today.
I certainly can. I can send you those templates, and you can certainly post them. I'd be happy to do that.
Excellent.
Great. We'll get that done. Thank you, Lisa.
Sure. My pleasure.
And thank you all in the audience for viewing our webinar. Please join us for the next 2 webinars in our series on May 31st and June 7th. Send us an email to join our contact list and to receive notice of future webinar offerings. To view our archived webinars and much more, also visit the NASHIA website. And if you're interested in joining NASHIA, we'd love to have you. Please contact Rebecca Wolfkiel, our Executive Director. Thank you again for viewing our webinar, and please remember to complete your evaluation when it pops up for you. Thank you.